Hi, it's Paul Sakis, Good News Broadcast, speaking to Dr. Anthony Cannon. Hi, Doctor. How are you?
Doing well.
Excellent. You're the Chief of Endocrinology at the Robert Wood Johnson University Hospital. Congratulations. Important work. And we're going to talk today about type 2 diabetes and I guess how it disproportionately affects the African American population and how maybe we can manage the diabetes in those that have this concern. So thank you very much for coming to Good News today.
It's my pleasure.
Tell us a little bit about, well, first, with type 2 diabetes is different than type 1 diabetes because?
Because in type 1 diabetes, you are dependent on insulin for life. It's a severe insulin deficiency caused by loss of the cells that make insulin in the body. It tends to affect more non-Hispanic whites than African Americans, and it tends to be a disease that is seen during the first 20 or 30 years of life. Type 2 diabetes is a disease where you're not making enough insulin, but often you can live without insulin, at least initially being given to you, where pills can encourage insulin release from the body. Certain other medications can make insulin work better and more efficiently. And it's a disorder that affects 90% of all patients with diabetes. So type 1 is a disease of complete insulin deficiency. It's 10% of the population of those with diabetes, and 90% being type 2, where they need insulin and or oral agents to get to goal, to get their blood sugars controlled to less than 150 milligrams per cent, or an A1C of less than 7%.
Okay, I see something good here. It says, and it's called Good News. All right, the good news is the results of a new sub-analysis across 6 studies may offer hope. Tell us about that study.
Yes, I had the opportunity to present data at the National Medical Association meetings in August of 2010, reflecting on preclinical trials that were analyzed by the Food and Drug Administration, the FDA, leading to approval of a new medication for diabetes with a great deal of hope for our patients. That medication was approved in January 2010. Its name is Victoza, and the trial data I reviewed was all the data that was submitted to the FDA in terms of preclinical trials, over 4,000 individuals. I looked at the African American group within that greater group, and with the help of other researchers, we were able to show that African Americans responded very well to this once-a-day injectable medication for diabetes in the presence, generally, of other oral agents of diabetes. The trials looked at patients who were failing to get to goals with various medications, orally principally, adding Victoza and seeing the success. The African Americans had wholly great success. In fact, 78% of patients with one dose of Victoza who are African American reached the American Diabetes Association goals of A1Cs of less than 7% or less than 150 milligrams per cent with this medication. Even more impressively, they lost a disproportionate amount of weight compared to the non-Hispanic placebo group. This is the first time we've been able to show, and to my recollection, a medication for diabetes showing this kind of success in the African American population. This is so important because the African American population who have diabetes, 80% of them are overweight or obese, and nationally, African Americans are 1.4 more times likely with diabetes to be obese over non-Hispanic whites. So this is a very important study to have done, and it really astonished us on how successful this medication was in this group of individuals with diabetes.
Besides obesity, are there certain characteristics in an African American, genetically that?
Absolutely. We've gone back and forth over this topic. I think it's really clear now that, in general, people of color, Hispanics, Americans, also African Americans, both of these groups have a higher likelihood of having diabetes. And in the presence of obesity epidemic and sedentary lifestyles, you're seeing a great deal more than you would have estimated simply based on a genetic likelihood. Great example of this, 8% of the population of this country of Caucasian background have diabetes. 13 to 15% of the African American population have diabetes. And it's that difference, almost twofold increase rate of diabetes, which is driving diabetes complications and concerns throughout the country. I just looked at some national statistics that said that 40% of the hospital beds in community hospitals, teaching hospitals, and the like, these patients have diabetes. 4 out of 10. So we're looking at a lot of complications, much too late, much too expensive to treat. We would like to get people earlier on better medications for diabetes and prevent some of these complications.
Okay. What are some of the complications?
Oh, sure. We have patients with lower extremity complications to include amputations because of nerve damage, vessel damage. We have people in the hospital on dialysis or nearing dialysis needs. There's an increased rate of heart attacks and strokes related to diabetes, and these are the types of things that lead to hospitalizations. By then, we have often looked at this treatment, or series of treatments for the complications of diabetes, as being too little too late. The real emphasis I see from the American Diabetes Association and other groups I belong to is to find out patients much earlier at risk. Know your score. Know your risk of becoming diabetic. Look at your family history. Look at your diabetes and high blood pressure and cholesterol issues, heart attacks and strokes in your family. And we're recommending in the African American group particularly that they get their blood sugar checked at 30, get their blood pressure checked at 30, know their cholesterol at 30, and work on lifestyle modifications to decrease the chances of becoming diabetic. Stop smoking, walk more, and we're now teaching fundamentally how to stay within one's cultural domain, eating the foods that you like to eat, but eating them better, eating them healthier.
Okay. When you say know the score, is that what you're talking, a lot of things, or is there
literally know the score in terms of your risk factors of becoming diabetic.
All right, good. How about young people in diabetes?
We're seeing, first of all, I want to make it perfectly clear the Victoza data that I shared with you is all in adult populations. We have no data in children or pediatric group, but really if you're going to prevent diabetes, you must go further back than the adult model and look at their children. We're seeing an explosion of new-onset type 2 diabetes in adolescent male and females of minority persuasion, particularly African Americans, who look like their parents 30 years early. 30 years early. The typical age of new-onset type 2 diabetes mellitus in this country is somewhere in the range of age 50. We're seeing 16, 15, 14-year-olds coming in who are quite obese or overweight with new-onset diabetes. We call it type 2 diabetes of youth. It looks exactly like their parents' diabetes, but 25 to 30 years earlier. And this is really going to be a major problem for cost and controlling diabetes if the children are starting so young. This is something we've seen only in the last 15 years.
Is there something once again in the gene makeup of, say, an African American that you think helps them to, I mean, it's not good news, but that helps them become obese? That helps them besides, eating a lot of food? Is there something that I take a cholesterol pill, and I think it's helping me and lowering my cholesterol. Is there because it does some things? Is there something in the actual human body of somebody who gains weight and maybe more prevalent in an African American's body?
I don't think I know that answer. I know that the obesity research that I read tends to show cross-cultural hormonal changes. As you gain weight, you gain more weight, in part influenced by certain hormonal mechanisms, which I don't want to discuss here. But I haven't seen it be any different in one group or the other. But I think we can get back to the prevalence of diabetes in the African American population being higher to begin with, and then adding the diobesity, the concept of diabetes and obesity, as Dr. Francine Kaufman has put it several years ago from her experience in Hispanic males and females in the pediatric persuasion, first-generation Mexican Americans. She saw this coming. She saw type 2 diabetes of youth in the Hispanic population, as we're seeing in the African American population, Native American population, and these children post-puberty but before their adulthood. We really do believe that these triggers are triggering the differences in diabetes, but the genetics, I think, really are more important to set the stage so that when you gain weight, you tend to be more susceptible to gain diabetes.
Well, we've been doing a bunch of shows on diabetes, and we're planning on starting a diabetes channel. Got a good buddy there, Ben Vereen.
Yes, what a wonderful buddy to have.
And boy, no one can speak. I mean, he's eloquent for a dancer about diabetes and a singer.
Absolutely. I know of his work.
So, and I think that's sometimes what it takes, Doc. I mean, a guy like you who really knows the inners and the outers of the medical science, and some, let's call them celebrity status people that, get that word out there so the young people and the older people start to pay some attention to this. Well, last good question for you. What's good news for you, Doctor?
The good news for me is to be able to have more tools in my toolkit as a physician, as a healthcare provider. I speak to primary care physicians often. 97% of all the care of diabetes type 2 in this country are with primary care physicians, PAs, and nurse practitioners. It's incumbent upon the patient to be proactive, to be part of the team approach to the treatment of their chronic disease. No more than your score. Know the medications that are available. If your medications orally are not working in combination, ask your doctor about such medications like Victoza. Would that be appropriate for your needs based on my research?
Okay, Doctor, thank you very much for sharing the good news with us.
Thank you very much.
Take care.